whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and chief medical officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. Today we're talking to Dave Casimiro. Dave Casimiro is the managing director of Northwest Healthcare Properties North America region. Northwest Properties being a global leader in healthcare real estate development across the world. Dave himself is a real estate professional with over 20 years of experience in commercial real estate, and in the last 18 years at Northwest focused on healthcare real estate in Canada and also more recently in the United States. He's recognized by peers and clients as an industry leader, and Dave is a long-standing member of the BOMA, the NAIOP, and the ULI Real Estate Associations. He was named to Globe Street Real Estate Forum's list of 2021 healthcare influencers and was also named to ULI America's Healthcare and Life Sciences Product Council in 2023. He's also been on the Michael Garron Hospital Foundation board since 2015. Dave, thanks for taking the time to join us today. Appreciate it.
Very happy to be here, and thank you. Nice to connect.
So compared to other types of commercial real estate or just real estate in general, what makes healthcare real estate so unique or perhaps challenging?
Great question, because I believe there are some differences with healthcare real estate, especially when compared to some of the traditional buckets of commercial real estate, office, industrial, retail. Clearly, the tenancy is different. We have healthcare physicians and practitioners and clinicians in our buildings. So from a pure use and visitors and patient flow into our buildings. And that also is the differentiator, but also unique in the sense of where that type of tenant base and patient visitor also can make it a bit challenging around areas of the building and sort of how people interact with the physical real estate when they are coming to see their doctor or coming in to see a clinic or receive some therapy at our building.
And so Northwest, just for background here, it's not like small properties. Like you guys are building giant like hospitals, bigger like commercial enterprise for larger healthcare associations. What does like a typical property look like for you guys recently?
So I would say on some of our international markets, Jordan, we have definitely developed and acquired and purchased some pretty large scale infrastructure, typically around hospital or institutional type. Here in Canada, we don't have the ability to own hospitals. We'll work very closely with them, and obviously they're physicians. So 4 to 6 story buildings we own, manage, as you mentioned, obviously develop. And then more recently, our entry into the U.S., similar, owning hospitals and owning multi-tenant buildings as well, all in the what we call the cure side of healthcare. So, not as prominent of a presence in care, seniors, long-term care. That's not a space that we're currently very active in. More on the cure, more focused in that area of the healthcare sector.
Gotcha. Yeah, I guess between the two sides of the business then, like the management aspect versus the development aspect, what's kind of the split there?
Well, given our structure being a real estate investment trust, so we pay distributions. So we're looking for what we call income producing properties, so existing. And then we do have the development side, which in turn we develop to eventually own. So I say we're much more heavily weighted on that income producing, that ownership, either through the development to own or acquisition. But more and more development is playing a bigger role within our company, and that's in response to obviously some of the demands from the user groups and our ability to access capital and work shoulder to shoulder with some of these users of our space and creating a space for them to come in and practice.
Very cool. I guess what's then the distribution like, urban centers versus getting out into the rural and remote and, otherwise underserved communities?
Yeah. From a management perspective, you want to try to cluster or amalgamate as many assets within a approximate geography of one another. You just get more economies of scale and more management efficiencies. But obviously, we have a big country and there's people living everywhere. So We do have some more, secondary, tertiary markets. I would say that historically we've sort of been across different rural and urban geographies, but more recently a focus on concentrating on markets where we can get some density, some clustering, as I've mentioned. So that's in and around a bit more populated areas and or the greater geographies of those cities and densely populated geographies.
And then why do people choose Northwest? I mean, clearly you guys are growing. You guys are a humongous company. I'm just looking on your website and like the amount of assets under management and projects under development. I mean, these numbers start with a B. So clearly you're doing something really well. Like, what is it that you guys are bringing to your clients?
It's, our focus is solely on healthcare. So we spend a lot of time working with and understanding those needs. As we mentioned earlier, it's a different building with different services. So having a better line of sight of what individuals, practitioners, hospitals, clinicians are looking for and adapting your real estate to that. And then obviously our management being solely focused on healthcare real estate, you better understand the requirements of those tenants, but obviously the patients and then how the building needs to perform in order to respond. So we spend a lot of time investing in and around our tenants or prospective tenants to really understand what they're looking for and how we can position ourselves to be that landlord of choice.
I guess, what are they looking for? Can you tell me more about like sort of the nuts and bolts of what's making healthcare properties so unique?
So I think that first and foremost, we need to provide a competitive proposition from a price point standpoint, but I think that goes without saying. But outside of that, obviously understanding HVAC requirements, accessibility, we're pretty forward thinking on the sustainability ESG attributes in our portfolio, again, existing and net new. Understanding needs around some of the janitorial services that our clients require, and being having a track history and being a trusted partner. It's been 20-ish years. And so we've been able to forge some pretty strong relationships and track record on our ability to continue to meet the needs of our tenants, current and obviously evolving for those future needs as well.
So when somebody's considering, setting up shop, they're going to make somewhere their home, like right from the beginning, you got to choose where, like just part of the city or neighborhood. Like what kind of thought goes into that, or how do you guys do it in terms of where to actually open up your doors?
A lot of our buildings are located within immediate or very close proximity to hospitals. And so there's an automatic connectivity between our building and the physicians and clinicians and practitioners at that hospital. So that's part of some of our investment thesis is where are we within proximity to a hospital, but also with a significant amount of population growth and housing growth, seeing the need to be in community. So that's also a focus when we're looking at demographics and new house builds and where and how are these, residents going to be receiving care. And that also is working with the relationships that I was speaking with, or have it be hospital or clinical or an existing tenant that we have in our portfolio. And hey, are you going to this new up and coming community? We're looking at putting a property there. So it's often existing tenant driven as to where they want to go and be able to service the community. So we are seeing a bit more of a mix between, within that immediate proximity to call it community based or health, a hub type of building where residents can get their care without having to necessarily drive to the hospital or closer into maybe the more dense urban areas.
That makes a ton of sense. So any of those type of synergistic neighbors next door, across the street, down the way, or being by the hospital. Okay, that makes a lot of sense.
We're seeing a bit of a hub and spoke model too, right, Jordan? So the bigger hospital will want to have some offshoots in the community to service the population on, less acute, some ambulatory clinical care versus having everybody come into the main hospital, and that impacts, emergency room wait times, capacity, et cetera. So we are seeing a move to a bit more of a hub and spoke model in the community.
Well, it's probably a lot easier for patients too, right? If they can start getting things all done at once. I mean, they're not always living in the neighborhood, right? If they're driving in from, adjacent town to do their cardiac testing, it'd be nice to get their knees x-rayed at the same time, in the building over by one of the other suites.
And so we work closely with our existing tenant base to try to understand what other service providers that they or their patients would benefit from, and try actively to recruit them into our building. So to your point, so that you're getting your x-rays or your blood work done in the building where your cardiologist is or your family doctor is. So really trying to create that synergistic building.
Are there any tenants you try and avoid being neighbors with?
Avoid, no. We have a couple of examples where we have buildings wherein it's not fully medical. We have some traditional office or other professional tenants in the building, but our focus is that healthcare provider. And we're patient and we have long-term views on our real estate, and we will wait to find that right opportunity versus perhaps just filling the space for the sake of filling the space. The mix is important for us.
And then I guess if somebody's ready to embark upon choosing a space, the first question they're probably going to ask themselves is, do I want to go down the rental, the leasing road, or do I want to own a place? What do you typically tell those people when they come to you?
Yeah, they're obviously they have their differences. If they end up owning, clearly, often compared to owning your home, you have to take care of everything that surrounds your home, from obviously your expenses and the maintenance that's required. It can take up quite a bit of your time if your focus is being a physician and you're managing these other aspects outside of your practice, right? Obviously, that has an impact. Leasing space, obviously, we enter into lease agreements, so there's a contractual period. And then you have individuals who focus, i.e. our team at Northwest, on the management of the building, wherein you don't necessarily, as the tenant, have to worry so much about that if you're renting versus owning. And then I come to the same point around, where are you owning? Is it an office condo, or is it a house converted, or a retail plaza converted? All of those have, some similarities and differences. But the leasing model is one where, again, and I say our focus is solely on the real estate piece, and then we try to support the best that we can those tenants in, delivering the best care that they can in their practice for their patients. That's our big motivator and one of our key objectives.
Just turnkey and much more, I guess, heady, hassle free if you go down the managed road versus doing it yourself.
Yeah, and we work closely with our tenants when they're looking to build out space, or if it's finishes, or we have an internal construction management team that we provide that tenant the ability to clearly input and design a space to their liking, so that we know that they're going to want to be there and practice there, and their patients and visitors are going to have a positive experience as well.
And how often do people come to you and they're like, okay, we tried doing this ourselves, we're ready to switch from sort of being in the driver's seat to going down the managed road? Are there just tons and tons of bad experiences that you hear about and they're like, okay, that's enough of that, we tried?
Yeah, ways of practicing have changed. And so as that has changed, so have, preferences around leasing or having a managed, clinic operation, or managing it themselves or owning. So we do see or have seen a bit more appetite and the coming together of physicians in more managed group practices, and outside of the real estate component, actual companies and entities that will work directly with physicians on assisting and actually managing their practice. So there has and continues to be an evolution, which I see continuing to happen, especially with obviously, technology continuing to play a role and some efficiencies around how that impacts practice management, but also technology and the impact that it has on managing real estate, and how do you bring those two together and create an optimal sort of solution for the respective parties.
What have you seen just over the tenure of your career? You've been doing this for almost 2 decades now. What's different back then versus today? I can imagine there's quite a bit on the technological side, but also the practice management angle.
I'll tell you the one that resonates with me the most, and I know that there are still some that exist, but when I started off almost 2 decades ago, as you've politely pointed out, everybody had a paper file room. Right? You could not design a doctor's office without a file room, and there were the rolling file system, so you had to always account. Clearly, much of that is gone. Obviously, that's gone digital, and file rooms no more. So that's been a big, from a design perspective, has changed. Solo practitioners are now multi-physician practitioners. So that's also been an evolution. And then without a doubt, electronic medical records. The way people practice and how they practice, not only working with their staff, but also patients in terms of bookings, billings, et cetera. So EMRs have been and continue to play an important role on how I've seen and continue to see the evolution. And that's more from a clinical perspective, noting I'm not a clinician, but just on how it's impacted the real estate. So, solo offices are now multi-tenant, so they're getting bigger. The file room is no longer, so is it getting smaller, and does that become an exam room? And then obviously from the electronic medical record side is ensuring that our buildings are, able to service that need for bandwidth and connectivity for these tenants.
When it goes to the technology side of things, like just making sure a building is going to work, like does it have to have the hardwired internet connections, or do clinics and places run off of Wi-Fi, or what actually goes into building that central nervous system?
Yeah, so we work closely with our building management team and ensuring that we have the infrastructure in place. So multiple service providers, ideally in today's age, fiber, but we have partnered with a third-party group to come in and assess our portfolio and to provide us with reports on, where that building is from a connectivity perspective. It's a scoring system, which then allows our teams to obviously continue to invest in and enhance, bring that score up so that we can be able to meet the requirements of tenants, and part of our differentiation as well. And so we have it's a certification. We have a certified portfolio from a digital perspective, and ensure that we're raising the bar in the buildings that come below our threshold, and continuing to invest and more importantly, communicate to existing tenants and prospects that we have, this available in our building.
And then does that, I guess, the technological and the electrical backbone, how much does that change depending on the size of the property? Like I imagine you start needing to have like electrical generator backup power at some point. And
so that's often based user tenant based, and then the size of the building. So without a doubt, in our portfolio, we have a lot of quite large diagnostic imaging groups that in some instances have a bigger electrical panel than the building. Also with, the ongoing movement to sort of move some hospital services into communities. So surgery centers, we have surgery centers in our portfolio, and those require, redundancy and backup. So we are investing in and looking to equip our buildings, either retrofit existing and or on a development, clearly developing for those type of uses and taking future use into consideration as well.
Very cool. Well, and then so last week I was actually at the dentist, and their panoramic x-ray machine had just gotten fried by a lightning bolt like a couple days prior. I don't know if you can comment on this. This might be a little bit too in the weeds with the details of it, but like, how do you, I don't know, let's say a big diagnostic imaging center, how do you just keep everything safe?
Yeah, well, I don't recall hearing that happening at a Northwest building, and so hopefully it wasn't. But nonetheless, these things happen, and clearly we work closely with our tenants and obviously the service providers, noting that some of our tenants are looked to, or many of our tenants are looked to manage their parts of their infrastructure directly, and then obviously there's the building infrastructure, right? So if that was the case and it happened and it impacted the building or the region, obviously we've got to work with the utility companies and power supply. There are one-off, I don't want to call them freak accidents, but these items do happen, but they are infrequent. And so we do have emergency response provisions and protocols in place for when they do happen. And it's not just limited to obviously power failures or lightning strikes in this case, but our team is equipped and to manage. And really, Jordan, it comes down to how are we communicating and how are we prepared. So you can never fully prepare for everything, but you build these plans and you go through them and you make sure everybody understands them and is able to move forward and execute on them when something happens. So
Prep for the worst, hope for the best.
Right. I think the pandemic was very much a trying and telling time for everyone, but obviously in the healthcare or the delivery of healthcare space. So we found ways to, quite resilient and adapt and be able to continue to deliver care, but in a modified format, which was one that nobody was familiar with. And, you know that you'll be able to leverage that on the next time that something of significance happens that impacts an asset or a tenant or a country or the globe. So,
Well, I guess with COVID, it's sort of just this, global pandemic. How did that change the design of properties just in terms of, infection prevention and keeping people safe from each other in these buildings?
So I think we probably obviously lots of questions around our HVAC system and air filtration and what type of filters are we using and not using. So that was obviously one of the first things that came up, and the usage of HEPA filter or bringing in, more air changes to get more fresh air in and circulate. So those are, mechanical system, I guess, modifications that you're able to make. From an infection control standpoint, clearly and obviously the masking, which a lot of people who are already ill pre-pandemic would be coming into facilities like ours with masks. So, enhancing that hand sanitization and the protocol around access to and from the building. And so waiting room spacing, etc. Additional cleaning protocols from a janitorial, in addition to what we do in a healthcare facility, obviously enhanced high touch zones, elevator buttons, handrails, etc., door handles. So that was very much a response to attempting to limit the passing from an infection control standpoint. So yeah, these are lessons learned and items that will forever, like it's just raised the bar. And then how you're managing, because some of our offices, for albeit a short period of time, were closed or temporarily closed, right, is managing your building systems. If you're no longer have tenants who are seeing patients, call it 18 hours a day, so how are you managing your systems to essentially get a bit more efficient and ensure that you're not unnecessarily using or consuming energy and better managing. So we've learned quite a bit from the COVID experience as well.
Well, how does, I don't know, maybe using like an average family physician's office as an example, like, so there's sort of the management of the systems themselves. How does that air filtration or the HVAC system, how does that actually work? Or what are the like mandated things you got to be aware of when doing something on a small to medium size build like that?
Yeah, so we have requirements as per code on specific spaces. So I think a family practice is a perfect example. So you have requirements there. And then when you compare it to a surgery center, as I mentioned, we have both of these tenants in one building. We have a number of examples of that. So a surgery center will require, a different type of airflow and fresh air requirement. So they may have dedicated to their space a supplemental HVAC unit, which will respond to their requirements, but only to them, right? So you meet the requirements of your family practice office and building code and based on a use requirement. And then you up that by adding supplemental systems to your existing system for a specific tenant, i.e. the surgical tenant who, obviously in an OR needs a different level of fresh air, relatively speaking, to family practice. And really what it comes down to, and I can't underestimate this, is when we're working with tenants and prospective tenants on the design, is really ensuring that we or whoever is building out the space has a real clear understanding of what their practice, how it will function. If you have 25 people in a waiting room, you need to ensure you have adequate space and obviously adequate ventilation versus having 5 people in a waiting room, right? So understanding that practice and the patient flow is important on how the mechanical systems are configured, and even lighting, because obviously lighting can heat up a small space. And so we work closely with our tenants and obviously our consultants on ensuring that we ask a lot of questions and have a pretty good understanding of how this practitioner or practitioners, this group, sees their patient flow within the clinic.
I mean, when it comes to the lighting, like, are there regulations on that? Like, do you have to have like a certain number of lumens, or how would they even define that?
We have a standard, which obviously from a sustainability perspective, we're always looking at improving lighting. Retrofitting is call it low hanging fruit. But we also acknowledge and recognize that, again, coming back to uses, they may have different lighting requirements. A sleep clinic versus ophthalmology group, right? So that's part of what I was trying to articulate, and really understanding the practice and sort of what and how they will be practicing. Use is usually the driving factor here, and which rooms that they'll need more or less. And so that's sort of how we navigate that on a practice by practice basis.
No, it makes total sense. I mean, if you're a surgical center and you need negative pressure in your surgical suites, and then if you're a sleep center, you're trying to get people to have accurate sleep studies, you're going to have
Exactly.
blackout, completely no light in there. So it's probably very bespoke depending on the project.
Yeah, there are some unique, tenants on that scale, but generally speaking, your family practice, your specialist consulting office, it's pretty standard construction and code requirements, unless they have an additional ask for either specific to what they want to do, or to how they want to have their space appear and that look and feel from an aesthetic standpoint.
And what about the design, like just the aesthetic of these different buildings? Is there like a personal touch that Northwest tends to go with across projects?
Yeah, we try to, obviously we have branding, so from signage and wherein we can incorporate that into our building. We take a lot of pride on having clean and accessible facilities for people to practice and visit. So from a standard finish perspective, we have standard finishes for common area washrooms, common area corridors. So we have some consistency across our portfolio. And then clearly for tenants who are looking to build out their space, we provide them with, some standard finish, some options that they're able to select from. If they want to go outside of that, they do have the ability to do that. Sometimes it's, price for price, it's the same or it's slightly different. We just communicate that up front so that expectations are known and met, and there's no surprises at the end of the day.
How much design or even like the architecting and the blueprint, for the whole building can you reuse across projects? Like, it's kind of funny because here in Alberta, if you're going through small towns, like the hospitals are almost like copy paste units of each other. Like, can you guys do that as well? Or is there too much specific, local bylaw or even provincial or state by state code for these developments?
So as development becomes more and more prominent within our business, you're right. You can get plus or minus a very similar footprint. We know what an optimal floor plate would look like, or suboptimal. How many elevators, how many floors. So we're pretty good at that, and corridor depths and where stairwells need to be. What drives that often, Jordan, is what kind of a site are we working on? Is it perfect or imperfect? So you either pick up a building and move it onto a site and it fits, or you have to make some adjustments to adjust to the site. And clearly use drives that. As I mentioned, surgical centers or surgical tenants are becoming more and more prominent in our portfolio. So the building needs to be able to adapt to that. So, bigger mechanical rooms and backup generators. A lot of the buildings that we've acquired that are of a certain era, their structure is you can't change it, and so it's grandfathered in by code. And so, on anything net new, obviously we're looking to correct that and have to build to code. But I would even say from elevatoring and the size of those elevators, obviously the ability to bring in stretchers or gurneys versus some of the older buildings that elevators are smaller and didn't necessarily have that into consideration. Corridor width, washrooms, we're from accessibility requirements to, multi-gender. So a lot of things that have and continue to evolve. But from a ground up development on a parcel of land that plus or minus we're familiar with, we can build a pretty nice, efficient building given our track record and our history, not only in Canada, but obviously internationally.
Very cool. Are you limited in where you can operate? Like, I'm thinking zoning bylaws. Like, is there a special category for medical or health, or is it just anywhere that you can have a business, you can have like a healthcare property?
Yeah, zoning does come into play with us and where we can and can't do things. So we either apply for zoning change or modification to permit it, or you look and you find sites elsewhere. When I say more and more, we're seeing, our buildings embedded in community. You can appreciate there's a lot of housing bills or apartments, but there's always some portion of that development where it's allocated to commercial, and that's typically where a building like ours would fit into the community there.
Very cool. Well, I guess previously it seemed like the just kind of Web 2.0 transition, having EMRs in all the rooms, having internet and connectivity built in everywhere has been like pretty characteristic of this last few decades. In general, where do you see the industry going, for the next 10 or 20 years? Is there anything coming up that you're really excited about?
Yeah, there are, from a building perspective, and I would like to say from a clinical perspective, at least from my line of sight, AI is already, but will continue to play an important role. I just think from a building management, we're looking at and testing out some technology that sits on top of our building automation system that will learn and then be able to come up with algorithms around where we need to service more air to at this time of the day, relatively speaking, to other parts of the day. So which floors get more use and be able to respond. So I'm pretty excited about that. And then obviously from a business standpoint, I think that, electronic medical records and those systems will continue to evolve with, as I say, AI playing an important role. So we are definitely on our radar and definitely looking at ways to trial and test and then deploy because it's here and it's going to continue to be here and evolve.
Oh, I can definitely see AI being the hot topic for many years to come. How do you future-proof a building? Like if you're taking over a project and renovating, or if you're building from scratch, like what do you even do for that? Previously, It was wires everywhere, but now everything's wireless anyways. Like what do you do to try and make sure that you can keep up with these trends?
So obviously it's moving quickly. You're right. My paper file room to EMR, like that happened in, relatively short period of time. This is moving even quicker. Fundamentally believe it. You have to have, the experts or those who are informed, involved, right? They have to be able to input. And I'm not saying that, you need to lead. You just need to know, because there are some limitations to real estate, right? It can't be converted. It's already reached its natural life cycle, right? So I'm not saying only at Northwest, just in general, right? So the future proofing of that asset is likely bring it down and rebuild something new. Or when you have the benefit of retrofitting or greenfield development, you sort of have, those consultants and that input right at the beginning based on what you know today and where you can project it's going to go. It's like, come back to some of the comments around digital connectivity, right? It's just ensuring that you have, if it's risers or points of entry into your building, how are you building that redundancy? That all happens at the initial design phase. And sort of where you're locating your building, are there services there? If not, when will they be there? Because you could potentially be limiting your building if services aren't going more around fiber and connectivity for X number of years, right? So it's really happens at beginning phase and bringing the right people in as soon and as early as you can in the project.
Makes total sense. Well, I guess on the other side of things, not just the functionality of how the building works, but more and more people are pushing for sustainability and just making sure that our the turtles are safe and the whales are okay and the forests are fine for coming years. Like what are you seeing in terms of trends for just making the buildings more sustainable?
Yeah. So fundamentally believe, again, we're publicly traded, so it's essentially table stakes, right? Investors are asking for it. It's very much part of more and more embedded as part of our DNA and in our thesis. And when I think of sustainability, obviously there's the ESG component. Being a real estate company, it's very heavy on the E side. So not to say S&G aren't, but the physical real estate. So we have and continue to spend a lot of time and investment in that E component because it has the immediate impact on our tenants and in our buildings, right? So if it's, I just mentioned, light bulbs, right? So a light bulb retrofitting project, that's low hanging fruit, almost a very quick sort of payback period and beneficial to the tenants right away. The S and the G, as I mentioned, are important, but that's also a bit more focused on our organization. So as an employer, and obviously from the social and how we're interacting with our staff, our team members, our peers, our colleagues, as well as our tenants. And then from a governance perspective, in addition to being publicly traded and sort of adhering to the governance of that, but how are we governing ourselves? Again, thinking about who our stakeholders are, how we're engaging with our tenants. So as I say, it's table stakes, and is continuing to invest in that platform. And I'm quite excited about it because I've seen quite a shift and change. And as I say, you're reinvesting in your properties and or wherein you're sort of net new, starting ground up. You have an opportunity to really, have a very efficient building, a very IoT tech enabled building. And so that's quite exciting, not only for me and in my role and my team, but also as a shareholder and then for our tenants as well. It's pretty exciting on where we're going and the impact that we'll see on the asset long term.
It's interesting that it's just become table stakes. Like people don't even need to ask specifically to be more sustainable with their builds and their management. It's just assumed at this point.
Jordan, I think that obviously people have differing opinions, of course, but I feel from, the investor universe, if you, which we do, and, be leaders and how are we doing that? Speaking, great, but actions, speak louder than words, of course, as we all know the saying. So I'm quite excited about how Northwest has and is approaching sustainability moving forward. It's incumbent upon us to communicate that to our tenants and to the prospects, right? So the investor universe is one thing, obviously a critical part of our business, but also, hey, what are we saying to our tenants? What are we saying to those prospects of what type of organization we are and where we're allocating and committing resources to improve and have an impact?
Yeah, got to be future proof, and that includes upon not just the building and the walls lasting over the decades, but the demand from clients also being there and the support for the company.
Materials you use to build with, the products you use within your building, all that is playing a part.
Awesome. Well, anything else you think is super critical to mention in terms of the management or the development side of things somebody should think about before undergoing a project?
Yeah, no, we've touched upon a lot of great things. I think from a sort of landscaping from where I sit in terms of, having a bit of line of sight on different provinces and obviously healthcare systems. I do see and continue to see, albeit some provinces further ahead than others, but the continued movement of services out of the hospital and into the community, folks around ambulatory and some clinical care. So I think that, the patient or the user of those services will benefit because it'll be closer to home and, not necessarily at the hospital, which will provide, much needed bandwidth and capacity at those regional hospitals and focus on higher acuity. So I do see that to be a trend that we're quite excited about and feel that we're well positioned to work with and partner on. And that's through acquisition and or development. How group practice is coming together and evolving, and the future of that, again, coming from a patient perspective and knowing that, your file is, you got one file and you're able to work into a connected system and get that care that you need independent of which physician or clinic you're going to. So it's pretty exciting. And we talked about the role of AI. I think that's just more broadly and exciting and, maybe a little scary too, and the element of the unknown, but nonetheless, we're seeing some pretty positive outcomes so far, wherein we've put some technology in play in our real estate. So it's exciting.
Awesome. Well, I guess before we end, what is your number one tip in terms of health and wellness? How do you keep the mind and the body feeling good?
I make sure you take time for yourself. It's easy to get caught up and sort of bogged down, but whatever sort of makes you happy and enjoy doing, make sure you find the time to do it. Balance means different things to different people. wherever your escape is and get out, I would highly encourage it.
You gotta take time to smell the roses. Awesome. Well,
100%.
Dave
Yeah.
Casimiro, thank you so much for joining us today. Really appreciate it.
Absolutely my pleasure.
Thank you for joining us this week on Leaders in Healthcare. If you enjoyed this episode, please like, subscribe, or leave a comment. And if you found this episode helpful, don't forget to share it with your network.